Hello, my name is Jarrell, and I'm a co founder here at Viva. The decision to get started with therapy isn't always easy, especially if you haven't been exposed to it before. Today, I'll be sharing with you some of the most frequently asked questions about therapy. First, what is therapy? I like this definition from Dr. Michael Herkhoff, who describes therapy as a process whereby psychological problems are treated through communication and relationship factors between an individual and a trained mental health professional. Modern psychotherapy is time limited, focused, and usually occurs once a week for 45 to 50 minutes per session. How long should therapy last? How long therapy lasts is entirely up to you and your personal goals, at least with us at Viva. Many clients start off with one goal in therapy, and throughout the process, they decide they want to continue with therapy after meeting that initial goal or getting through a tougher period. We have clients that work with us for the short term, like a month or two, and clients that we work with for years in ongoing therapy. If you're unsure about what feels best, ask your therapist for more specific thoughts based on your progress and ongoing needs. The moral of the story is that therapy is made to work for you. How much does therapy cost? Well, this depends. If your therapist is considered in network with your insurance company, then you will pay less out of pocket expenses. Essentially, you pay your copayment directly to your therapist, and they send a claim to your insurance company for the remainder of the cost. Most people will only pay a small copay. Others may have to meet a deductible first, but this largely depends on your specific insurance plan. And if you don't use insurance to pay for therapy, then you will be charged what's called an out of pocket rate, which you will pay directly to your therapist at each session. Also, keep in mind that most therapists have late cancellation or no show fees that are clearly explained in paperwork before you start therapy. At Viva, we offer some insurance slots, out of pocket slots, and reduced fee spots, which are also called sliding scale, to meet a range of needs and circumstances. The average therapy session cost around the United States is between $100 to $200 per session. Another question that gets asked very often about therapy is, how often should I go to therapy? This also depends on your personal circumstances and goals for therapy. Generally, most therapists offer weekly appointments initially and explore less frequent meetings over time, depending on your desire and need. However, biweekly and even monthly sessions are also common. At Viva, we don't require any particular frequency. We will offer you the options available and help you find a frequency that works with your schedule, finances, and desired outcomes for therapy. What is virtual or online therapy? Also called remote therapy or distance counseling, virtual or online therapy means meeting with your therapist via an internet connection. This means having your session with your therapist via video. In most instances, you will virtually check in to an online system, and the therapist will initiate the call at your previously scheduled session time. Then you'll have your session as normal. Another common question about therapy is, when do I stop? Well, this largely depends on you. It is always important to discuss your progress and how you're feeling about the process of therapy with your therapist. Don't be afraid to share how you're feeling and thinking about the process overall. Often, this helps the therapist gain better insight into what needs to happen in order to help you reach your goals. Some signs that therapy is working, and this varies by your personal goals for treatment, could be feeling less anxious or less down and feeling more peaceful, getting more rest, and seeing improvements in relationships, work, school, etc. You and your therapist will decide on what best reflects progress through the initial phases of your therapy. How do you get started with therapy? The first step to get started with therapy is to reach out to a therapist or practice that you think could be a good fit to set up an initial consultation call. This is usually a 15-minute chat to explore fit between therapist and potential client, as well as briefly talk about your biggest concerns and goals. At Viva, we've made it easy. Just visit the new client section of our website to send us a note to get started. More frequently asked questions are to come in the future. Thank you for listening.